The quick context of this is when the pandemic hit and really started to globalize, a year ago, as a community of, technologists, informaticians, et cetera, that were, clearly working in and around this space, there was just this prevalent feeling that we had to do something. And we had the good fortune within the community of having folks that are, on the front lines, in the emergency rooms that were, supporting and helping the, first responders and providing direct care. We had people that were in public health. So we used those folks, to kind of help steer us towards something that would be of value to the global community. And that's where the Navigator came from. So why don't I go ahead and jump in. Again, we're a small enough crowd. If you have questions as we go, I encourage you to just jump right in. I'm happy to take those questions as we proceed. So what problem are we solving? COVID, I think, has really brought to light and this is something that's shared with the BPM community. It's really shine a spotlight on the fact that the body of medical knowledge and what we know is ever changing. And I don't think there's a better possible example of how important it was to get new guidance out to the world at large as soon as possible, and to make that available to folks and to make it discoverable in a way that people can find what they're looking for and actionable, so that they could consume it and apply it in terms of what they were facing day to day. And given the pace of the spread of the disease, as well as the responses to it, it became really clear that there were some big challenges in doing that. Everyone was spinning as fast as possible to uncover discoveries about what we needed to do to respond to the pandemic. What were good practices, and a lot of that, absolutely still, holds true today, as true as it did a year ago. The state of change is constant, and one of the things that emerged is that finding the source of truth was really difficult. There might be 1,000 sources of truth, but it was really difficult to know what to look, where to look, and how the pieces fit together, because everyone was kind of working in their own lane. So if God forbid, the poor caregiver that was trying to figure out what the right thing to do was. A great example, I had a conversation, this was really early into the pandemic. I mean, we were 6 weeks in, with someone, I think it was a hospitalist, informatician, who was working, just ridiculous number of hours per week at the time, getting, a few hours of downtime, and they spent those few hours surfing to try to figure out what they should be doing better. And it just wasn't working. And so we felt that as a community, this was something that we could help address. The idea was to provide a complement to search engines. So a search engine is great when you have that magic combination of keywords and you know what you're looking for. But how do you discover something when you're not quite sure what you're looking for? And I'll use retail shopping as an example. So I'll just use Amazon just as a for instance, because I think this is something they do well. You go into Amazon looking for this thing or that thing, and this is not an endorsement. This is just an exemplar. I'm looking for this product or that product, and they have their AI bit relate things behind the scenes, and then say, you were searching for this, you might also be interested in this, that, and the other thing, and not that often, or it's not uncommon that they're right, and some of those other things that they've identified are things that I might be interested in. Where is that for healthcare? So if I started out looking for something around personal protective devices, or sterilization of protective equipment, or whatever the case might be, there might be something related to that that's not really based on that specific combination of keywords, but it's kind of a lateral, that is something that should be on my radar. And that's really what this portal is about, is to create those counterintuitive connections to expose assets or related topics or materials that weren't specifically what someone started out looking for, but are in the same camp, or are related in a way that isn't necessarily derivative. And that's really what this is about. So in terms of how this relates to our community, this is us being good global citizens. There's no ulterior motive. We're not trying to use this to advance BPM specifically. I mean, if collaterally It helps in that regard. That's terrific, but that's really not the point. The point is to put tools out there to help in the knowledge discovery. Are we aware that this would work beyond COVID? Yes, of course we're aware of that. And we're not worried about that just yet. Let's do what we can for now. And then if there are other uses down the road that make this, more value or continuing value, certainly we want to explore that, but that's not the immediate focus. The last piece, which I want to I really draw attention to, is we've done this on zero budget. There's no grants, there's no money, there's no sponsorship. This is people who made time in their day to contribute to this, and some of them have put in substantial amounts of time. There was a period where we were really trying to get the meta modeling right, and we were having calls hour and a half a day, every day, or almost every day. Let's say 4 times a week, and this is all pro bono. And we've had a lot of organizations donate, some resources, not financially, but teams in kind, letting folks work on this project, perhaps a little bit on the clock, and we're very grateful for that. So with that, let's just go ahead and press on. So what does the Navigator do? And I'll get through my bit, and then Lorraine will lead us through some live demo and show you the tool. So what it does is it allows users to graph and browse to discover relevant assets and knowledge of potential interests. So we spent a good many months, vetting a meta model, and this kind of manifests in this knowledge graph that you can see on the right side of the screen there. So we've got the COVID Navigator in the middle, and then you have kind of the first order of how we've separated the world, and that's kind of represented by the legend. So you can come in based on searching or browsing by subject, browsing by the part of the care process, by care setting, and by resource. But this is not a hierarchical model, it's a polyarchical model, and we'll get into that in the demonstration. Once you actually go through and do some discovery, this is not a database. Think of it as more of a metadatabase. It has links to where those real sources of information are held. So we're not curating content. All our curation and inclusion is very lightweight. Is it a credible source of any form or fashion? Then, as we included in the tool, has it been classified correctly? So it's discoverable, appropriately within the tool. And then, we rely on the browse capabilities to let users discover the parts they're interested in. Let me just see if there are any other bullet points here I want to talk to. There is filtering, and we'll talk a little bit to the filtering in a few minutes. But the biggest difference here, it's not intended to be a replacement for the search engines. It's intended to be a complement to help that discovery and that browse. And I think a good analog is like the difference between online shopping, for a book and walking into a bookstore. So, where I'm one of those who used to be able to spend hours and hours and hours in bookstores, because you'd go in looking for something specific, and you'd end up in a section, and you kind of flip through the volumes and find things you might be interested in that weren't originally intended. And I think that's really a lot of the thematics underneath this. So that's what it does. So the key benefit of this exploration is that of interrelationships. So we might pick a particular subject, in this case, I've shown kind of care management, and here are a bunch of assets or discoveries that relate to that subject. So I might click on one of those, in this case, a British Medical Journal best practice item, and I came in looking for through care management as a subject, but this same artifact relates to a whole bunch of things that aren't just care management. It relates to acute care, it relates to screening, it relates to guidelines, and so on. So I might, based upon this couple of clicks, find myself looking at telemedicine guidance, or find myself looking through guidelines, or find myself searching at epidemiology. And that's this idea of this lateral discovery. And then as you pick pieces and you select specific nodes, the tool will pop up relevant content based on your filters and your clicking to show you similar or relevant assets, based upon the types of things you're looking for. And from these, you can pull up short descriptions and then actually go see the assets themselves in their native form. So why produce a Navigator, search versus browse? So search is great if you know what you're looking for. It's better if you know how to search for it. it's challenging in a search engine to see interrelationships among things. And there are a lot of sites out there that are solving the direct search space, and we're looking to collaborate with those to provide the content, into the navigator so that we can help make these things more discoverable. Browse is, I think, it's a complement to that. It's more suited for this organic discovery, and this ability to navigate across different links. It helps you to know what you don't know, and we see it again as complementary. So the filters within the tool, and hopefully I'm not stealing all of Lorraine's thunder here, but we do have a set of filters. So you can say, for example, I'm only interested in mature type artifacts, and we've got definitions of these things. So for instance, a level 5 maturity is like a systematized review, something that's been peer reviewed, it's been adjudicated, it's evidence-based, all that stuff. Or maybe I'm setting my aperture a little wider because right now I just want to get a feel for what might be out there, and I'll determine whether it's relevant or not and assess the maturity myself. So the filters let you kind of narrow the scope of what would pop up. We have a number of additional things coming in the filtering space. This is definitely an alpha product, and you'll see some of that in just a moment. I can choose the areas that I want, and it'll show you that we've got a set of active filters that are applied to what we're looking at, and then ultimately that carries through to the actual selection of assets. So without further ado, hopefully that set a little bit of a context for kind of what we intended, and I guess the spirit of the initiative. Why don't I pass it over to Lorraine to let's spend some real time in the tool, and then we'll come back and talk about where we are in the alpha and how you can help. So I'll stop sharing and pass it to you, Lorraine.
Just looking to share. Okay, screen 1, that's what we want. I think you should be seeing the navigator, correct?
Perfect, yep.
Okay.
I think you inadvertently muted yourself, Lorraine.
There we go. Are you hearing me now?
Yep, sounds good.
Yes.
Can you go full screen on your navigator?
Yes, I just have to move the pictures of people out of the way for the full screen. Okay. There we
Mark
go.
actually posed a question in the chat. He says, this is really great and very generalizable. Is it open source? Would appreciate any links.
The short answer is yes, it is open source, although we haven't done the open source code drop yet. We're waiting to have a stable alpha before we do that, but we can come back to that.
Yeah, there's a few known issues that we'll see as I walk through. I jumped back to actually the homepage for the COVID Navigator so you could sort of see where you'd start. And I'm just going to go into the browse from here. So there's a little bit of information about what this is and how to use it and things available from there. Oh, that got fixed overnight. There was a bug that this was always opening when you came in from the homepage and not when you did the refresh. So I just picked a piece to navigate through where I knew there were assets. So there's just a little bit of a roadmap. There's home buttons come back and forth. There's a way to suggest new material, which we'll come to later. I'm going to actually include showing the asset instances in the graph so that when we get to finding something, we'll see them. We're expecting there's going to be lots of material here. And so one of the goals was to find ways, once you find what you're looking for, get the noise out of the way so you can actually see it. So for instance, I've come in here, I'm interested in clinical features and diagnoses. And there's our first bug, by the way, because sometimes the graph will re-center when you've selected something. But now I've looked at in detail clinical features and diagnoses, and it showed me all the different assets that are related to that by that subject. And so let's there's the one that, this is actually the one that Ken was talking about in his session list. Let me pick that. That wasn't my first guess. And once you get down to an actual asset, it tells you a little bit about the organization that submitted it and how it was categorized. Now there's a lot of material here. If I wanted to, let's say, it's filtered. So now there's nothing actually in the graph by consensus opinion of those, of that data type. I should have actually stuck with the one I had originally written down for the Navigator.
Proof that it's a live demo.
That's right. And you'll note that as you're browsing around, you will, the graph will reorganize, and then you can navigate to other things that are related. So, okay, we've got a resource around managing long-term care. Let's try that one. And what?
Sorry, one quick thing, Lorraine. So for folks that are watching, the navigation and the repainting and the movements are all smooth when you're doing it as a direct user. The web sharing makes it look really choppy and more difficult to follow.
Okay, yeah. I didn't realize that the web sharing was making it go choppy because I haven't looked at it that way. So we've navigated into managing long-term care, and then we might be interested in other aspects of prevention.
So this is Mark. Real quickly, when you're getting a description of that particular asset, are you hovering or clicking on that asset?
It pops up. You can get a description also from clicking on it, and then the description pops up. The other place it will show is if we're down to the point where there's assets on the graph. That particular, so the NHS coronavirus resource will, yeah, there's their portal. It'll show up in the right-hand side, and we'll actually have that access to the more info box from there. And then we have access to go direct site. Question I heard?
Yeah, this is Ken. Why don't you go? Yeah, I was going to say show them the click through.
I didn't want to lose my tab. So that takes you to the NHS's site. Now, when I was actually putting together the demo yesterday, I was thinking, well, okay, this is a list of a whole bunch of resources. What if I'm interested in finding other directories and lists? And of course, our refresh bug is haunting us, and there's actually only about 38 assets in the data in the system right now. So one of the things we're looking at is having alpha testers help us build those assets. But that's now taken me to other places like the Maryland State COVID-19 vaccination information. Now, what if I know about something that I'd like to suggest should be added? And I actually looked up something that I could add last night. So the link pre terms. Just grab the URL for that. And there's probably a description I can cheat from for here. When it's full screen, it keeps propping down the WebEx thing and getting in my way as I change tabs. Okay, and this publication type, it's a web asset. There are keywords later to say it's terminology. We don't necessarily know the asset version yet. Ken, would you just leave this as unspecified for their pre-release terms?
Well, so you're going a little bit fast through this, Lorraine, because I know you've done a whole bunch of these. So maybe
we'll stop.
So we've got the URL, the description, those are self-explanatory. The publication type, or you could just go back to that one and So one of the things that and this all goes back to the kind of meta modeling, we were trying to strike a balance between making it easy enough for consumers to direct contribute without needing an informatics degree, with enough specificity that it was actually useful down the road. And we spent a huge amount of time trying to find the right balance there. So in so doing, we separated maturity from the nature of the publication. So this is the distribution channel. Did it come out as a web publication, as a white paper that was in a journal, that kind of a thing. So in this case, that's why she chose web. The asset version was, maybe if Loink had said that this is code set release version, 12.07 point whatever, we would have included that. But that's self-identification of the asset itself. That's not something we're assigning. That's the way it's self-identified. You can choose the native language or the expression of the asset in the third pull down. It defaults to English, and we've tried to put them in decreasing order of likelihood based upon available sets.
And these things will drive the lists for the publication type on your filters.
Yeah, absolutely. And then asset maturity, and again, we don't have, there are definitions in these, I don't know if they're all in the tool yet or not, but level 5 is, so think of this as like CMMI type or HIMSS type maturity level. So level 5 is consistent, repeatable, evidence-based, metrics-based, all that kind of thing. Level 1 is all bets are off. It could be anything in the world. And level 3 is kind of consistent and repeatable. So Loink as a process, I think, has some, consistency and maturity to it. But if these are kind of new ones, if they haven't kind of asserted what kind of review they've gone through, I would go with unspecified.
Yeah.
And the concept behind the tool is that we would have a pool of volunteers that are doing a validation, lightweight validation of the submitted. So if Lorraine entered something that said level 5 maturity, we would have someone come in behind that before it actually gets promoted and say, does that sound right? They would look at the site and say, no, that's probably not a level 5. So we would have a quality check there.
Yeah, and we wouldn't necessarily expect everyone to fill in all the classification boxes, although they could if they had an opinion. I made sure Regan Street was in as an organization before I started this. And so this audience, well, it's probably, I would say this is direct care, public health, administration and research.
That's good. Do you want to put any keywords on that?
Sure. I'll go back up there. I just selected terminology here. Okay, so keywords. What would you suggest?
Why don't you put Loink as a keyword? Put terminology as a keyword. Just as a start.
Yeah, and this is creating a curated, basically a list of terminologies. If you type ahead and it's already there, it should tell you. Didn't save. I haven't.
Hit enter after each word. Don't use the comma.
Yeah. That's better. I hadn't tested that yet. And it's applicably is global. And then we're just going to save it at that state. Now I'm signed, it's actually told me it's been successfully created. I'm signed in as administrator, so I can see everything, including my own drafts.
So Lorraine, this is Mark again. If you published it now, could you still go back and edit it? So, for example, you wanted to add keywords to it.
Yes.
Okay.
So if you logged in as just a normal user, you'd get a list of drafts that would have your drafts in it. And right now there's one that was submitted by Mark, which hasn't been reviewed and promoted. So you can go in from here and edit.
Sorry, let me back. If you look under the status, the last column, we've got the statuses are actually across under the keyword asset, the title of the screen. You'll see there's kind of different tabs. Those are basically the states that the submissions can be in. It goes from draft to submitted to pre-classified, classified, and then published. And then there's it's not fully implemented yet, but there is a permissions-based model behind this. So once something has been published, not anyone can go, update it. And people can update their own assets up until a certain point. But, we do have kind of an escalating thing to that. But you can, we have roles assigned, and one of those roles is like a content knowledge manager type thing. And knowledge managers would have the ability to add keywords or correct errors, that kind of a thing.
And it won't show up in your searches until it's been actually published. So we could go in and classify this one. And I may occasionally ask for help as we go through the classification. Definitely diagnostics. Probably
Not diagnoses, probably.
uh,
I guess I'm not.
yeah, not a clinician.
Yeah.
Public health and case reporting.
Probably epidemiology. Oh, not the clinical epidemiology, right? Because that's
Oh, that's right. Yeah.
um
Do you want it to show up in all care processes? Possibly.
yeah, no, I think that's okay. I'd err more toward inclusive.
No, we get terminology.
So we're kind of getting a little in the weeds again. So
Yes,
so
I
the
know.
idea of these are the classifications. Those are how you express those semantic relationships among the assets. So as you say something's appropriate to a care setting, then when someone browses over to that care setting, that creates the semantic link between that asset and that care setting, for instance. And then as we go deeper into like the knowledge resource, so if this is a particular knowledge resource, you can say, is it a policy, is it a guideline, whatever. And then as you start to browse those types of knowledge assets, this would show up.
Yeah. So if I say I've published this and saved it, so if I go back to the knowledge graph map and search for laboratory environment, which is a process, right? No, it's a setting. There it is.
The repaint is being worked on as we speak.
You'll see that the LOINC pre-release, the link to the list of their pre-release codes is there, and we have the link to LOINC. Let me go back.
Yeah.
Sorry, I had to get out of full screen so I could get rid of that. Well, it's because I have a whole bunch of windows still open on the other screen. Apologies.
No worries.
There we go. We've got Safari.
I think you're showing the wrong window, Lorraine.
Yeah. Let's do this for a second.
So I see the comment, Mark, in the chat about AIML. So if you've got some ideas to help us, with the curation and population of this, we absolutely would love to get you involved. Just while Lorraine's sorting this out, where we're heading with this, we've had some conversations with these existing portal sites. We've got an agreement in principle from one of them, which has like 300,000 assets already cataloged and loaded. And they'll provide us a flat file feed so that we can bulk load the tool, and that's our intent. We've got a team in place that'll help us do the ETL or something like that. So we don't know how ugly that process is going to be. The first step, critical path, is to kind of get the alpha done and make sure that we're not missing a critical metadata item, and that the ones that are there are usable and everything before we do this kind of large scale work, but that's right around the corner, and that's where we are at the moment. We also have the potential to get to 4 or 5 other portal sites through some of these industry collaborations. So that's all being explored right now. Well, anyway, we'll pick that up when we get back. Go ahead, Lorraine.
Well, it's probably a good time to stop and ask for questions. I guess the other sort of features that we've already built are a bunch of the filtering, which we've talked about. We do have some definitions, particularly around the filters, that you'll find on the filter section. And certainly we're looking for participants to both test the usability, to test entering assets, and volunteers to test creating assets. Let's see. The other piece where there's activity coming, we've been talking with the AHRQ ACTS team around tracking activities and work that's going on in addition to just tracking deliverables, so that if you're working on a specific aspect of the knowledge research and you want to look for other people who are working on similar things, or if you have a gap and you're looking for something else, where we have features built in the planning for tracking activities and organizations as well. Those actually aren't finished from the development team yet. So our alpha is delivering the assets themselves, but not necessarily the activities.
You haven't shown the progressive reveal, Lorraine. You might want to do that.
Okay, I had forgotten about the progressive reveal piece.
So Lorraine, you partially answered one of my questions. This is Mark.
Yes.
About the metadata, because the metadata about what's happening is incredibly valuable for this kind of an operation. I'm thinking about, taking this and generalizing it within a healthcare organization where, you have the incredible rich set of data on research papers that nobody can ever read because they can't find them. And having the ability to find them is one thing, but then knowing what your colleagues within the organization are looking at and why is also very valuable data.
Yeah, and we have a backlog of items that we're hoping to get into this. So for instance, tracking user metrics, so knowing what people clicked on and when they clicked through to things and all that is, it's on the radar. We're a long way from having that implemented, and that's not a short-term priority. But we see that's one of the reasons why we see there's tremendous long-term potential in the work that's been done here. Again, the focus has been on COVID, and that's really where all attention is on that right now to get this out there, and we want to get it populated and start to add some value there. But by no means is the work gone, or is this throwaway once we kind of get our arms around COVID as a nation, or as a a globe. We think there's huge opportunities in the knowledge space, and one of the reasons that the AHRQ folks are keenly interested is they're in the knowledge dissemination business, so they see the potential here too, and that might provide fuel for some of the sustainability. I should mention we've been using acronyms, so for those that don't know, AHRQ is the U.S. Agency for Healthcare Research and Quality. So they're the quality management organization for health across the U.S. And fairly well known globally.
Yeah.
Do you want? So, we were talking about the progressive reveal,
yeah.
Lorraine. Do you want to show that, or?
Sure. Ken mentioned the progressive reveal, and one of the things we know is that if we had everything graphed here, you wouldn't be able to read this. So one of the things we did early on was we only show 2 layers down from where you are at maximum. So personal protection, I think, is one of the areas where we have lots more content. It's slightly harder to see when it reorients on us. But we've only added in the assets that are related to that as we come down. It's actually probably easier to see if I turn off the asset instances.
Oh, we're talking about different things. Turn off the show all categories is where I was going.
Oh, okay.
So for some, the fully populated thing is pretty intimidating. So you can kind of explore as you go, and this is kind of the knowledge graph for dummies view, right? So you can come in and say I'm only interested in care processes, and then click to that, for instance, or
And
you
that
can turn that
actually,
branch off entirely. Yeah.
turn on and off here. So let's go back at it a different way here. And we can turn off everything but care processes, for instance. It also does let you move things around and rearrange things as you need. There's probably not very much in the.
But the progressive one, Lorraine, do me a favor. Turn on, go back to your settings and turn off the show all categories and turn on the instances.
Okay.
So we can start with this, and then I can pick like the subject bubble on the down, not the, yeah. There you go. And when I select that, it's going to shift focus, but now it's focusing on just the area that I'm interested in. And then from here, I can choose which one has some data. Pick one.
Probably personal protection, which should have some data.
Here we go.
Yeah.
Clearly some bugs there. Go back to subject and then the repaint is frustrating. Now we'll choose personal protection. So it lets you have a more focused view of the world. So I can come in and now I can look at the world around the personal protective. So that's the idea of this kind of progressive. It's just showing you the path that you're navigating down as opposed to the whole world at a glance. So again, with only 50 assets, the view is a little easier, but even now it's already getting a little messy. Add a couple of 100,000 and that becomes untenable. So we tried to engineer in the tools to allow the end user to slice and dice this in a way that they can discover the stuff they're interested in and ignore the stuff they're not interested in.
I was just looking to see what would, taking it down to government source, what that would do there. And that brings us down to only a couple of assets.
Yeah, so that's a great example, right?
Mm-hmm.
The other piece that we didn't demonstrate yet is this idea of third-party curation.
Yeah.
So we have the ability to, so we put a lot of time into the analysis. So for instance, the U.S. Centers for Disease Control and Prevention might recommend an asset or cite a particular protocol or something, and you can actually capture that in the tool. Or Mayo Clinic might endorse a particular pathway or whatever the case might be. So you can, in effect, decorate or describe a particular asset with those third-party curation authorities. And where we're heading with that is that becomes either a filter element or a navigation element. Show me everything that has been endorsed by the UK National Health Service, or show me everything that's referenced by the CDC. So this is where it's done in the data entry, and then you can add a curator. Go ahead and click on it just so they can see how that works.
Yeah, I've got John Hopkins up. I didn't get let's.
And then we could say that the Johns Hopkins Research Center has been endorsed by, or this particular protocol has been endorsed by whatever the case might be, and then you can filter on that. So again, we're not differentiating which are good endorsers or bad. That's for the end users to decide. All we're trying to do is faithfully express those relationships. Someone that believes that the best curator is McMaster can go in and say, show me everything referenced by McMaster.
And I should probably at this stage, let's just have a look at what's here. Would you think you would adjust the maturity on that one? On the John Hopkins Coronavirus Research Center directory link?
It's not immature. Is it peer reviewed? I mean, it's at least level 2.
Yeah, Mark submitted it. He's on the call. He might have an opinion. because this is how it came in. Let's go. Let's think about that harder, and I can promote it later. I was thinking I might be able to promote an
Well,
asset.
go ahead and promote it. Promote it now. I mean, data's going to change,
Yeah.
so we just want to. We're not. We can't give guarantees around the content. We're
Yes.
doing this in good faith,
All
right?
right, so yeah, so this is Mark. I think I'm the one who submitted that one, and I copied straight off of their website. Some of the stuff, put it in quotes as well.
Yes. Okay.
All right. So why don't we say the maturity is level 3? I think they've got a kind of consistent and repeatable process for including that stuff.
Okay.
So why don't we start there?
Okay. Yeah,
And that may
it was
not be
for me
right.
to say.
No, but I mean that's part of, and we'll learn as a community, right? So we have a classification guide, and we'll have to update that as we learn. But I think, from a data entry, Mark, you did exactly what we would hope. Someone would go and fill it out to the best of their knowledge and comfort and ability. That puts it on the radar. Then a content curator would come in behind them and validate that they applied the criteria correctly or make adjustments if not. And then once we're comfortable, we would submit that for publication.
Okay, thanks.
Which in this sense means promoting it into the site for visibility. All right. So she's going to change the status to published. And then now, once it's published, the next person to go in and look at it would find that asset. So
Yeah.
when it's in
Thank you.
draft state, it's not discoverable, by other parties. It's just available to system administrator types, higher roles, and then the submitter themselves.
Yeah, and we would
So-
expect that if the submitter says it's still draft, we'd wait till you're finished with it and you move it to submitted.
So why don't we pop back over to the slides for just a minute? Because I have a couple more things I want to
Okay.
cover there, and then we can come back and in an open floor and address any other questions we have. So I'm gonna share just very quickly. Where is it? There we go. All right. So this is whoops. So this is a kind of a vignette. It's not the fully elaborated meta model, but this gives you an idea of the thinking. You've seen some of this in practice. I'm not going to dwell on this. These slides will be posted. But we thought we spent probably half of the time over the course of the year. It took longer than we hoped, but again, it's a volunteer effort. We probably spent 5 months trying to get the meta model right, because if we didn't get that right, then this was a waste of time. So it underwent a substantial amount of revisions. There are some areas that are not yet elaborated that we think we might want to fold in later, but it seems like at least the opinion of the core team was that it's good enough, and that's really what we were shooting for, is good enough. So that's the meta model. So where are we in this mess? The version that you just saw, the alpha version, was in effect released about a week ago. And we're in alpha testing now. We started with a bit of a controlled alpha. We reached out to colleagues and peers that we thought would have a direct interest in this and asked them to kick the tires. Some folks like Mark were kind enough to step up and do that for us, and we're incorporating their feedback now. Today, we want to use this session to broaden the alpha, and anyone that's interested in engaging with us and playing with us a little bit, we would really welcome your help, and we'll have an email contact at the end of the slides in just a minute for how you can get in touch. You can browse the site now. I dropped that in the chat, so you can go mess around looking at what's there, but not contribute anything without an ID. And we don't have the ability right now. We have to set you up with an ID. There is no ability to self-register yet. That's still coming. To participate in alpha, we're asking for about an hour's worth of time, and we have a loose test script for you to walk through, a set of activities for you to perform, and then provide your feedback on that. We do have some known bugs. We've shown you some of those already, and those are being worked on. I mentioned the bulk data load, and we're in the process of trying to get that sorted and secure it. We have some resource commitments for the development resources to do the ETL. to load the stuff. We have some agreements in principle from at least one content source site, and we're going to reach out to a couple of others. If anyone has contacts in that space or wants to help in that space, we certainly would welcome that as well. From a sustainability point of view, we're still focused on just volunteer at the moment. There's possibilities down the road to get, grant money or whatever to make this sustainable as a public good. And I'm interested in that once we kind of get our feet under us, but I don't want to waste time. We don't want, the intent of this isn't commercial. So we're not focused on trying to capture money in budget at the moment. We're, maybe myopically continuing as we've been going. But I think when you consider how far that we've covered with the resources that we've had, I'm certainly incredibly proud of what the team has produced. For acknowledgements, I do want to call out 3 organizations in particular. Softarex is a software development shop, and I had a personal relationship to the CEO there. So when we were looking for someone to help do the development on this, I rang them up and I said, hey, we're trying to do this. We don't have any budget. And he's like, why don't I give you a development team? So we're really grateful to them. They've pro bono provided a full development team, and we're getting kind of commercial support for no money, which has just been tremendous. Forge Forward has been doing project management for us. Again, this is all pro bono, but they've been doing project and program management support, multiple or dozens of calls a week for close to a year. So we're certainly grateful to them. And Book Zerman has been helping us with Scrum support as we engage with the development team. So there are many, many others. I don't want to list every single name because I'd certainly forget somebody. But it couldn't have been done without some of these. Again, this is not sponsorship. This has been folks rolling up their sleeves and doing work.
Yeah, we had 4 different work streams ongoing for the first 6 months. So there was a lot of activity going on, with a large number of volunteers.
Yeah. So if you're interested in the alpha, David Cook at forgeforward.com, he's our PM support person, and he'll get you set up with an ID and send along all the test information. We have on the BPM call calendar, our calls are public. We've canceled them for this week, but we have a couple of calls. Right now, those calls are really just about the alpha for the moment, but as soon as we get the data load piece spinning up, we will have dedicated calls kind of working on that piece of it. So let us know. My contact details, Lorraine contact details are here, and we can drop those in the chat as well. But interested in, we've got 10 minutes left here. Interested in your thoughts or comments, and we're happy to go back to the demo to explore something that anyone's interested in. Any initial impressions? Things you like, things you don't like? Is it usable? Are we way off the mark?
I think so. I mean, I usually, just in my job, I have to engage with healthcare organizations kind of at the strategic level to help them translate business into technology, but I'm a gearhead at heart. And my wheels are spinning. I see all the parts and pieces that it must have took to put this together. And I think it's a nice complement to deep search services where not just, articles or unstructured data, but even structured data to browse, any kind of a data lake or data pool that has the ability to be weighted or categorized by topic. This approach is very useful.
Thank you. Appreciate that. Any other reactions or comments? Okay. Well, if for those that are interested in getting involved, please do get in touch. The alpha will probably run for another couple of weeks, as we collect comments, and we're not waiting until the alpha closes to address concerns. So some of those kind of screen repaint and reorientation issues are well known bugs that are actively being worked on. The development for this has been done open source, and our expectation is to make that code drop available. So we're figuring out where that's going to land. But BPM is the umbrella organization kind of sponsoring the effort. So anything will be available from the BPM site in terms of being able to navigate to the ultimate assets. All right, Lorraine, any closing words? Oh, sorry, Clement.
I have a reclama. This is Mark again. So when I go back into the Navigator, COVID-Navigator.org, and I sign in, and I look at my one draft asset that I want to submit. If I go to assets and I go to all it has like the published ones. If I go to drafts, it has the asset list is empty. So I'm wondering if that's a bug, or am I not
yours
signed in?
would be empty now because we just promoted yours to production, so it's not
Okay.
draft.
Well, there was another one, the Worldometer one, which is draft. So.
Yeah, there's. Yeah, I think he's.
I think we've promoted all of yours, Mark.
Okay. All right.
So, Lorraine, do you want to pull it up and just see all the draft assets in the entirety of the system?
Well, yeah, but the list is empty of all drafts. So.
There is one
Yeah,
draft
I think
that hasn't been promoted yet.
I'm still sharing. Still sharing. Lorraine, you want to screen share?
Submitted.
Okay. Should be coming.
So what my recollection, Mark, is you had 2 or 3 assets that had been submitted in draft.
Yeah, I had 2.
Yeah, and one of them's still there.
See, there it is right there, but it doesn't show up as draft in mine. My list shows nothing. Oh, there it is now. Now it shows up. That's weird. Huh. Okay.
All right, can't explain that one, but we can
refresh it. I just hit submitted and it just refreshed it. Oh, wow. That's fast. Okay, that's good.
Okay.
Okay, cool. Right. Live
right,
demo.
so we're getting there. The team, the development team has done a lot. We're using the graph tool is an open source tool that they've made substantial adjustments to the framework to accommodate us. They've done a lot of performance tuning. So some of us had used an earlier, the public iteration of that, and it was pretty poor responsive.
Mm-hmm.
So we're getting there, and I can tell you that the improvements, week over week have been tremendous. So we're looking forward to knocking out the big bugs. But at this point, the number of big bugs we have remaining that we've identified is down to digits on a hand or 2 hands, which isn't to say that's how many bugs are left. Those are just the big ones. We've got dozens and if not hundreds of issues we've identified, but we're getting there.
So as I understand, you have things like National Health Service. So this should appeal to an international audience, and I'm wondering if you start looking at country specific statistics and policies and stuff like that. Have you all given thought to how you might slice and dice that or categorize that? Would you have like a separate page for national?
Absolutely.
Yeah, I'd be interested in seeing how that pans out.
We can show you that. We actually spent 2 months on that very problem, Mark, and the where that came up, and one of the reasons it was so challenging is parts of geography we could use enumerated value sets, and there were well-established code sets that could be used, but others were very organic. And how do you deal with the mix, especially when you don't know the country necessarily going in, or you had bubbles around COVID? So for instance, there at one point was a travel bubble around Australia, New Zealand. So that was not a specific geopolitical formal entity. It was just an agreement, some sort of understanding. You also had regional agreements. So I live in the national capital area in the US, and I know you know that area as well, Mark. Yep. So for those that don't, that's Washington, D.C., the state, parts of the state of Maryland and parts of the state of Virginia are all considered the national capital area. And this is a real example, is they established policies that were based upon proximity to the city and not based upon the state or the county specifically. So if you were in a certain proximity to DC, all of the local governments agreed really at a county level that they would follow the same protocols in terms of mask wearing, in terms of restaurant opening, in terms of businesses, et cetera. But from a terminology point of view, in terms of managing that within the meta model, that was wicked hard. So we actually
Okay,
found
good example.
we came up with a balance. Oh, Laureen's showing you the UML model. This is where we ended up, is we had this notion of something's global, it's applicable to anyone, or it was a subset. And then we had this concept of pan country, which could be any aggregation of countries. So that could be NATO nations, it could be the EU, it could be this bubble in Australia, New Zealand, whatever. But that was string based and not ontologically based. And then you had countries which were ontologically based. And then within a country, you had the ability to create aggregate, subsets. So that could be states, it could be collections of states, it could be the Mid-Atlantic region in the US, it could be the Loire Valley in France, what have you. Or it could be discrete elements which were coded. And then you had the ability to get to localities, which again could be terminology based or could be string based. So it was a very, very difficult problem, and that's part of the reason it took us, so many months.
Yeah. So did it drive you to drink yet?
Yeah. Well, we never really came to a consensus on a really usable way for people to data enter that, and it was just one of those problems that was going to take us too long, and we decided not to hold up the alpha to solve that.
So but the short answer is, well, actually, that's not the short answer. The long answer is yes, we've thought about it. We're trying to again, the overwhelming intent is pragmatism. So we could have gone pure academic and said everything has to be coded, but the reality is that's who would maintain those code systems? It would be difficult to sustain, especially when you cross countries. So we're trying to find the right balance between usability and repeatability.
Okay.
Great question.
Thank you, sir. Great presentation.
Great. Well, thank you all for joining. And once we're through alpha, look for a beta announcement. My hope is that beta goes live with a large volume of content. So we don't want to go to beta with 100 or 200 assets. We want to go to beta with 4 digits, 5 digits, 6 digits worth of assets. So if you're interested in any part of this in terms of sustainment, lightweight content, review and promotion, getting involved on the technical side, please do get involved.